Welcome back. In my conversation with the president of the Medical and Dental Consultants Association of Nigeria, he speaks on the assessment and experience of health workers in the fight against COVID-19. Professor Kenneth Ozoilo, thank you very much for speaking with us on Dateline Abuja.
Thank you very much, Ibrahim.
I'd like to start off this conversation by getting your assessment on the various approaches to stop the spreading of COVID-19 thus far. And I'd like you to look at it both from the federal and state levels.
Thank you very much. I think that the first thing for us to be mindful of is the fact that this disease is novel. Okay, it's something that the world has not witnessed on a scale like this. To that extent, it took a lot of people unawares. Even the best prepared systems were taken unawares. So if you look at the efforts, especially in this country so far, of containing it, you must concede that some successes have been achieved. The fact that it started elsewhere and had such massive destructive effects in terms of the high numbers of infections and mortalities meant that we had sort of warning sign. We had a prior warning, we had a small window to try to put in place some measures to, as it were, contain it. Whether or not these things were done in good time and to what extent they were done is a subject of debate, but there is no doubt that, you know, we had the window to carry out some preventive measures. As it stands currently, the approach to the whole response still has a lot to do with that prevention, because we know that there's no established treatment, specific treatment for the virus itself. And so there is every need to try to prevent it, you know, and so the efforts of government, I think, thus far should be commended, okay, but we must recognize that there are so much more that is left to be done.
We've seen them, you know, their responses to this pandemic. The first thing you hear is isolation centers, and I don't know, maybe to an extent, the screening centers. But what is the response you're getting from your men on the front line?
I must confess it's not so good, okay, because very few states, from what the feelers we're getting, have actually established formal isolation centers. Okay, and you know, in the approach to this response, there are several stages. You know, a lot of people have adopted a lockdown, which is fair, you know, depending on how practical it is and the degree to which it's enforceable, you know, but that is only one aspect, okay? Now, for the isolation centers, I don't think this is something that should be left to the federal government alone. You understand? I believe that states have facilities, states have resources. There's no reason why every state should not have its own isolation center. You understand? But we don't have enough, okay? And unfortunately, some of the structures that we've designated as isolation centers are not really conducive. Okay, it's not just a place, it's not just a holding area to hold people. There are some certain basic amenities. It has to be comfortable. You have to provide sanitary conditions. There has to be water. There has to be electricity, you know, and so much, you know, a lot of stuff like that. And this is perhaps one of the reasons why you have some people that are supposed to be in isolation bailing out. Okay, there have been, you know, reports of people escaping. A few days ago, somebody was being hunted down for escaping from the isolation center. So I think that our basic concept and understanding of these isolation centers should be such that it has to be decent enough to actually accommodate these people and then provide their basic living needs and basic medical needs.
As a professional body, I'd like to know how you're working, you know, your collaboration with the Federal Ministry of Health.
Yeah, our association is actually the umbrella body of all clinical medical specialists, you know, across the country in public tertiary health institutions. And the membership spreads across so many disciplines. In this particular response, I mean, we have members who are epidemiologists, public health physicians, we have medical microbiologists, You know, we have infectious disease experts, you know, whose works has been, you know, dealing with other infectious diseases, not just this current outbreak, you know. And of course, we have the critical care specialists. We're lucky that so far the disease pattern we've had, you know, is predominantly the mild and moderate forms of the disease. We have not had so much of those that require critical care, but we do have the specialists, okay? And yes, our members are at the forefront in the hospitals, you know, all over the country. And if and when the patients do come, you know, the responsibility for their medical management falls squarely on the shoulders of our members, along with other health teams.
COVID-19 has thrown up a lot of issues, hasn't it? And one of them for us as a nation is the state of the nation's health facilities. What lessons should we be learning, especially the federal government?
I think the lessons are protean, you know. One doesn't want to lament, you know, unduly, but the truth must be said that, you know, one of the reasons why we're in this situation like this is because of the previous state of the health system. Okay, I believe that number one, the health system has been neglected in terms of funding, in terms of due attention to issues confronting it. You know, prior to now, we've suffered issues relating to the poor health indices. Our maternal and child mortality is, you know, way low there, you know, with the rest of the, you know, other parts of the world with poor systems, the life expectancy, you know, so many, you know, things like that. In addition to that, you know, I believe that government has not shown enough commitment. And when I say this, it's with every sense of responsibility, and it's cumulative, okay? Successive governments have not paid due attention to the health sector, okay? The health sector funding, you know, from a recommended 15%, what do you have, you know? Well, any year you do, any budget cycle, you have up to 5% allocation. It's tend to be high, and nobody's talking about actual disbursements and what actually we're able to achieve. The health system is one in which, you know, medical tourism has held sway prior to now, you know, especially among the elites and even the middle class, you know, and you have people traveling out of the country to seek medical care in other parts of the world, where incidentally, sometimes they get managed by the same Nigeria colleagues that have left here. And that brings us to the issue of brain drain, you know, and we've been hammering on this issue of brain drain for years before now, because our medical specialists are leaving the country. They were leaving the country, you know, before now. You know, for so many reasons, okay, not just limited to remuneration, but, you know, issues to do with other work conditions, job satisfaction, the equipment to work with, and all those things. So this has been cumulative, you know, so to say that the system was caught unawares is not to exaggerate it, that is the fact. However, we believe that in trying to confront this COVID pandemic, okay, we think that yes, the stopgap measures are okay. Let us buy the masks and the PPEs and the ventilators and all that. But we have to look at systemic issues. How do we strengthen this health system to be there in the event of another challenge in the future? Make no mistake about it. COVID-19 will run its natural course. It will run its natural course. Okay. The fatality and the toll it will take, we cannot predict, okay? But the truth is that there are emerging and re-emerging challenges, okay? And if it is not COVID-19 today, it may be something else tomorrow. As we speak right now, Lassa fever is still raging, and it's taking a greater toll in terms of mortality across the country, okay? And they're all infectious diseases, you know, it's similar systems you need to put in place to check them. And so the point we're making is that our approach to confronting this should be holistic. We need to fix the health system in its entirety.
What you say? But I would like to thank you for coming on Dateline and for your insight on this issue.
Thank you very much.
Let me also convey our appreciation to your members on the front line keeping us safe. Thank you very much.
Thank you very much, Ibrahim. And thank you for the good work you're doing. Keep it up.
Thanks for staying with us, and I'd like to also thank you for your mails. Let's continue the conversations online through the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality with us. I'd like to also remind you that you can view the program on youtube.com/channelsweb/videos. Remember to wash your hands as many times as possible. It's one of the surest ways to reduce your chances of contracting the virus. Thanks for watching. I'm Ibrahim Adra. Stay safe, and we'll see you next time.